every Saturday morning. All right, today, Saturday can be anything to anybody. Saturday can be a party Saturday, it can be a visitation Saturday, it can be anything. But for us here at VOP 90.3 FM, it's a health Saturday because we bring health talk show to you every Saturday morning. And of course, today is quite a special day. Yes, a special day because we'll be talking about something special. Yes, we've talked about a whole lot of health problems, but today we'll be talking about kidney failure. Yes, that's why I said it's a special day because it's so widespread now. When you go to the hospital, you see a lot of people suffering from kidney diseases, dialysis here, people on social media begging for help, for dialysis, for kidney transplant. And you keep asking, why is this thing so rampant? Why is it everywhere? Why is everybody suffering from kidney diseases? Well, I have a doctor in the house. Dr. Winnie, good morning.
Good morning, everybody.
Yes, Dr. Winnie is here to talk about kidney failure. Winnie is a beautiful, beautiful doctor. Well, if you want to see Dr. Winnie's face, do well to watch us live on our YouTube channel, Voice of the People 90.3 FM. Just log on to Voice of the People 90.3 FM. You can also watch us via our website, voiceofthepeople.ng, to see what I and Dr. Winnie looks like. All right, welcome. It's Voice of the People 90.3 FM, and this morning we'll be talking about kidney failure. So, very soon, during the course of the discussion, I'll open up phone lines. So, if you have any question concerning kidney failure, kidney diseases, Dr. Winnie will respond to your question. All right, Dr. Winnie, you're welcome. You're very much welcome.
Thank you.
So, I want to ask, why is kidney diseases so widespread? Why is almost everybody suffering from kidney diseases?
Okay, thank you very much for that question. But to answer that, I would like to start from what the kidneys are and what they do in the body. So kidneys are part of our vital organs. But when I mean vital organs, I mean like organs that are very important for our well-being. Kidney is one of them. The heart is the other one. The brain and all. But kidney today is kidney. So kidney are pair organs in the body basically, and we are created with two kidneys. They are located in the body, and they are quite small, but their function is, when they say something is small but mighty, yes, that's the kidney, because the kidney is almost the size of your fist, which is small. But then thinking about the function, it has a lot of function, a lot of important functions in the body. Some of the functions of the kidney include like filtering excretion of waste products like urine. Kidney also helps us in regulating our blood pressure, maintaining normal blood pressure, also helps in keeping the balance of fluid and electrolytes in the body. Also, the kidney has the function of producing red blood cells, also helps in vitamin D metabolism and keeping the pH of the blood normal. So when I mean pH, I mean it's either how acidic an environment is or how alkaline the environment is. So basically it helps to keep it within normal pH. So those are the functions of the kidney. So if you say what are kidney diseases, basically kidney diseases are any disease that can affect the kidney, and by affecting the kidney it will interrupt its normal function. So that's kidney disease. And why is it widespread nowadays? So there are certain risk factors that predisposes people to having kidney diseases, and so many causes of kidney disease. Okay, there are so many causes of kidney diseases right now, and risk factors. So for risk factors, most times is our lifestyle. Most of us don't have a very good lifestyle or a healthy lifestyle, ranging from what we eat to our behaviors. Like in Nigeria or in Africa, so many people believe in taking abo. This is not a good practice because over time it can affect the kidney. Also, when we talk about bleaching creams and all these lightening.
So sorry,
creams,
Dr. Winnie. What you're trying to tell me is that taking agbo, these are agbo, these are roadside agbo is bad.
yeah, over time it's bad to the kidney, to your kidney health, because some school of thought say that this abo contain what we call water pill, so it kind of dehydrates you. But in general, abo is very toxic to the kidney. It's also toxic to the liver because these things will have to be metabolized by the liver, and the metabolites will now go to the kidney to be filtered. So imagine if the kidney is filtering toxic substance, just like you take acid and you have to, can imagine what, for example, if you drink an acid, imagine how bad it will be in your stomach and how you feel. So it's still the same thing, sort of, that the kidney has to face when filtering all these things. Then we move to people with hypertension.
Okay, you were talking about bleaching cream before I asked the question. Let's talk about that. You know, it's very common. A lot of people bleach their skin. Let's talk about that.
Okay, so bleaching cream, yeah, and all these lightening products, they have some substance in them. These substances are what causes the lightening, yeah, but then our skin is like very what's the word? Our skin can absorb things. So when you use all these bleaching creams on your body absorbs them into your bloodstream. And bear in mind that it's whatever that goes into your bloodstream that reaches your kidney to be filtered, because the kidney is filtering blood. So when these toxic substances reach the kidney, over time, it might not just happen all of a sudden. It will take time to happen, but gradually and most likely, person will come down with kidney failure. So some of these substances are mercury and hydroquinone. In fact, right now it's been banned. Like, you can't get hydroquinone from just going buying. You have to go through the normal channel. So it's not something that is readily like out there.
All right. So what's some other thing? Talking about high blood pressure.
Yeah, high blood pressure is another risk factor for having kidney disease or kidney failure in future. Because thing is that hypertension can go both ways. It can either predispose you to having kidney disease, or when you have kidney disease, you can have hypertension. So they go hand in hand. Then also diabetes. Diabetes is one of the common causes of kidney failure nowadays. So many people have diabetes, poor lifestyle, poor sugar control, which can in turn lead to kidney disease. Also, high cholesterol level is also another implicating factor. Obesity weakens your immunity. Obesity can predispose you to so many diseases, not just hypertension and diabetes, can also predispose you to having kidney failure. And alcohol and smoking also are other risk factors for developing kidney disease.
Thank you very much, Dr. Winnie.
Thank
All right, I want to ask, do you suddenly have kidney disease? If no, what are the symptoms? What are those things you will see and you will know that it seems I have kidney disease or I have kidney problem?
Okay. Do you suddenly have kidney disease? Well, yeah, it could happen. So we have two types of kidney failure. We have acute kidney failure and the chronic. So by acute, this is something that is happening all of a sudden, happens within hours to days. And then for chronic, from like more than 3 months down, it can go on, linger around for years before the person finally comes down with failure. So yes, some things that can cause acute kidney failure are like, you know how some children are having vomiting and diarrhea over, and it's a lot. You can't even count the number of episodes they've had, and the parents don't really bring them to the hospital on time. Over time, these children get very dehydrated, and they get dehydrated, so there's nothing for the kidney to even the kidney does not receive any fluid or blood or whatever, and they develop acute kidney failure. Also, for someone that was involved in a severe motor accident or any accident at all, and the person has lost a lot of blood, so it's basically causing what we call there's no blood flow to the kidney basically, and that alone can harm the kidney. There are also like places for drugs, infections also that can cause acute kidney injury. And then for chronic, this one has to go over a long period of time, and most times it's from diabetes, hypertension, poor lifestyle, people that smoke, take alcohol, obese people. These are the people that are most likely going to come down with chronic kidney disease.
All right, but before someone goes to the hospital to run a check on him or herself, are there things you will see on your body? You know, like high blood pressure. Doctors say you have this headache, you have fatigue and diabetes. You drink a lot of water. You know, So are there symptoms that you will see and you suspect, or you tell yourself, it seems I need to go to the hospital to run a check, it seems I'm having kidney issues? Are there things one can see and know that it seems you're having kidney problem?
Well, yeah, for the most part, yes. And then it all boils down to what is causing the kidney disease. Like we have different types of kidney disease. We have different types of kidney disease. We have like or different causes. There's like infective causes, obstructive causes, whatever, whichever one be the case. For example, in case of infections, like some people have this pain when they are urinating, burning them. Imagine when you want to urinate and you are feeling pain, this kind of discomfort, you can't even urinate properly. There's also like urgency. You can't, you just sit down, you just feel
You-
like you want to urinate.
The
You
next
have
thing, you pee on yourself.
yeah, you have to rush to the toilet to go and urinate, or you're always urinating. Like you notice that maybe before I can stay for a long time, I've not even gone to the toilet, but now it's like almost every hour I'm going to the toilet. At night I have to wake up so many times, maybe 5 6 times to go to the toilet. You can't even have a good sleep, because when you sleep you have to wake up and go to the toilet. So all these ones are called irritative symptoms. Then there are also obstructive symptoms. So basically you have to force urine to come out, because
Okay.
it feels like something is obstructing the flow of urine. You feel like, okay, for most men now when they are urinating, you feel like, oh, after urinating it will stop, they have to try again, continue, stop, it keeps breaking. Or when they finish urinating, there's still this feeling that there's still urine left in my bladder. So these are like some symptoms of kidney. Then not forgetting the other ones I mentioned, that someone that is having vomiting, diarrhea, which can lead to acute kidney failure. But then this is where the trick is, because for chronic kidney disease, most times they don't have symptoms. And remember, these are diabetic patients or hypertensive patients. So they it's basically just from follow up. So that's why it's actually important that you visit the hospital regularly if you are having any of these chronic diseases, so that you can be
That's
followed up.
hypertension and diabetes.
Hypertension, diabetes, yes. So like they'll give you appointment, maybe come after 3 months, come after 2 months, like that, depending on like individual. It's based on the person actually, because some people are quite stable than the other. So when you check them, there's what we call the kidney function test. This test will help us to know, okay, how well this person's kidney is working over time, and by that you can judge. But if it's for symptoms, most times they don't have symptoms. It's until they've gotten to that tail end, where we call end stage renal disease.
Can you imagine?
That's when they start to show some symptoms, and some of the symptoms they can show are due to retainment of these toxic substances in the body. So these toxic substances can cause skin itching, can make them feel nauseous, vomit, can cause swelling in their faces, around their eyes, their face. In fact, sometimes all the body, because the body is retaining fluid, it can't urinate. Yeah, so there's also like some people who complain, I can't pass urine again. Like in acute kidney disease, you can't urinate like you used to. Some people can't even urinate like throughout the whole day, which is quite, it's unusual, because there's a certain volume of urine that you should make per hour. So imagine if you are not even urinating at all. That's what we call anuria, or reduced volume of urine. That's oliguria. So it depends.
So basically, kidney disease doesn't show any symptom
It shows, but then it
at the
depends.
tail end, at the
Yes,
end
chronic
stage.
kidney disease, yeah.
All right. So I'm sure people at home are listening and hearing. So you need to run a check on yourself. If you're having if you're a diabetic patient, if you're having high blood pressure, please run a check on yourself. It is very necessary. That is what Dr. Winnie is saying. Go to the hospital regularly to check yourself, because high blood pressure and diabetes can lead to kidney diseases. All right, doctor. At this juncture, let me open up the phone line so that if anyone has question, they can call in to ask. So the phone number to call is 0700 903 903 903. 0700 903 903 903. Also, if you want to send us a WhatsApp message, the number to send the message to is 0700 903 903 9. So call in to ask Dr. Winnie any question regarding kidney disease, because that's what we're talking about today. So Dr. Winnie, now still talking about kidney disease, let us look at ways we can help ourselves, because you've talked about lifestyle contributing to kidney disease.
Yeah.
So, what are ways we can help ourselves, like preventive measures, to protect ourselves from having kidney diseases?
Yeah, okay, that's a very nice question actually. That's a very nice question. Thank you for that question. So, one of the ways we can actually prevent kidney disease basically by living a healthy lifestyle, from like exercising to what you eat, trying to eat healthy food, reducing salt in your diet, low cholesterol diet, taking more of high fiber diet. All these are ways to prevent based on dietary modification. Then also people that smoke, people that takes alcohol, try to reduce your alcohol consumption, and if you can quit it. Even quitting smoking is also another preventive measure. Then if you are in the habit of going to just buy pain medications without doctor's prescription, you should actually consider that, because most painkillers have been also shown to cause kidney disease in the long run. So have to bear that in mind. So it's better you use a medication that is recommended by the doctor. Also, if you are diabetic, if you are hypertensive, you have to make sure that your sugar level and your BP is well controlled. And how do you control them? By taking your medications, by trying to live a healthy lifestyle. And if you're overweight, you try to lose weight. Then bleaching cream, try to stop it, because all these things can lead to kidney
Someone
disease.
was telling me about drinking water. What has water got to do with the kidneys? Drinking enough water. And some people will say, yes, drinking enough water and then drinking little at night. During the day, you drink plenty of water. At night, you drink small. So, what has that got to do with the kidney disease?
Well, yeah, you have to stay hydrated to help your kidney function well. And I know some people say when you take too much water, you're overworking the kidney and all. So probably you just drink water as tolerated, but try as much as possible to take a lot of water, maybe up to like 2 liters a day if you can. So yeah, like some people will say 6 glasses a day or whatever, but just stay hydrated, drink water. There are some people that don't drink water at all. They will drink juice from morning to night, but water, no. So it's not good.
So, there's nothing like overworking the kidneys because they are doing what they are supposed to do.
Well,
It's just like telling the eye not to blink. All right, Doc, let's talk about the available treatment options for people having kidney diseases.
okay. So there are various treatment options available, but then you'd have to identify the cause so you know how to treat the person. So if it's a kidney issue that is resulting from dehydration, you have to give them fluids, like to replace the fluid they've lost. If it's because of blood loss, you have to transfuse them. And then in cases of chronic kidney diseases where they are coming down with this disease because of hypertension, maybe diabetes, high cholesterol level, you'd have to treat and make sure that the levels of their blood pressure and their glucose is within the normal limits. So they'll have to be on their medications, coupled with some lifestyle modifications that you would have counseled them on, like weight loss, eating healthy, kind of reducing protein in your diet, because the kidney would also, like at the tail end of kidney failure, you can't really the kidney can't really excrete all these toxic substances, and then you keep on building protein the body and can't live. So we kind of recommend that you reduce protein diets. Some I think people know what protein diets are. Yes.
All right, I think I know what protein diets.
Yeah. Then also there is dialysis,
Okay.
but dialysis is reserved for overwhelmed kidneys, when the kidneys can't function again, for that end stage renal disease. So in that case, we can offer dialysis, and there's also renal transplants. But thing is that dialysis is expensive. Depending on dialysis all your life is for when people get to that end stage renal disease, it's not even a matter of how wealthy they are. Because at this point, you probably would have stopped working because you can't keep up again. And you have to be going for dialysis maybe 2 times a week, or for some people every week, or some people even like 3 times in a week. So it can be very overwhelming. You start to see yourself as, oh, I'm a burden to my family members. I can't really do what I used to do before. So it's mentally draining, physically you don't look that well again. You've lost weight, you are looking very weak. So I would rather advise that you would try to prevent it from even happening, because it's not about how rich you are. And even if you are rich, a friend of mine used to say that some people are just a sickness away from being poor. So it's not that you are rich, so you rely on your wealth. There can be you can get sick to the point that even your money can't even help you again. So it better you just prevent it. Yes, so there's renal transplants. And renal transplants is also another serious treatment, because you have to be physically, mentally, and like we have to really grade that you are fit for these surgeries. Not everybody that goes for renal transplant. There are some people that you will not even recommend it for. And then like in other developed countries where they have like list of transplant, before it even gets to your turn, you might have even passed away some cases. So
Can it be done in Nigeria? Can kidney transplant be
yeah,
done in Nigeria?
I
Because I hear a lot of people saying they are traveling to India
India.
to go do transplants. Can it be done here in Nigeria?
Well, I think there it can. I've not actually seen any patient that did his or her own here, but maybe there are specialists that can do it. But I know most people travel out to do it.
Then there's a situation whereby someone will do a transplant and the next thing the person start reacting because this is not the person's kidney, it's another person's kidney. So it's like a foreign body. So why the reaction? Why those things?
Oh well, we call that transplant rejection. So
Okay.
basically, your body identifies this as a um, foreign object and is beginning to attack it. So it's your immunity that is attacking that like transplanted kidney, because this is not mine. This is not what I'm used to. Sort of something like that. Yeah. So it's not always. It doesn't always work. Even after a successful transplant, you have to pray that your body doesn't reject it.
Can you
And
imagine? That's not. It's not as if that's the end treatment. Like
yeah,
you're
like
okay.
still
That's
has
you have to pray.
complications. Yeah, there are still complications to every procedure that we do. So it's quite
All right.
unfortunate.
Thank you very much, Dr. Winnie, for that insightful talk this morning on Health Talk with BB this morning. A lot of people they expected me at 9:30 a.m. and when they heard Kids Trend Show, they were like, it seems she's not coming, and that's why we're not getting calls. All right, but just bear in mind that every Saturday at 10:30 a.m. you hear that Health Talk. BB will be here with experts in their various fields to talk about different health issues this morning. Thank you so much, Dr. Winnie, for coming in for this program. We really
Thank
appreciate your
you for
effort
having me.
and time. All right, please don't go away because at exactly 11 a.m., we'll bring you Business Roundtable and Business Launchpad with Peter and Nosike. Please don't go anywhere. We'll be right back.